Now let's talk about the mask mandates and masks coming off. Here at Wake Forest, or Atrium Health, up here in the Wake Forest area, we are going mask optional tomorrow for our academic spaces, for administrative spaces, and for our education spaces. The hospital and the acute care hospital and the clinics, masks will still be required. And so for those of you who are Atrium Health, Wake Forest Baptist employees, teammates, that's the way it's going to be for us. So in the campuses and the buildings where there are no patient care areas, you don't need to wear a mask, for example. In the early education spaces and some of the other buildings, you don't need to wear a mask. And the communication has gone out, so you can look for that on the intranet or in your email, and you'll see it on how to do that. But the important thing is for everybody in the entire community, in the entire triad, is that when you're going into a healthcare facility, be it a hospital or be it a clinic, you need to wear a mask. And that's because we're under OSHA rules. And to tell you the truth, it's a good idea because there are more people who have illnesses going to hospitals and clinics. And when you get sick, what do? You go to a doctor. And so, we need to have that protection for our staff and for our other patients. So be a good citizen and wear your mask for health care because it's important. It'll also help protect you. Now, masks, as time have come on, have been an important tool for us. And I'm not going to diminish that. You'll see a lot of stuff out on social media, a lot of misinformation saying masks don't work. They actually make you sicker. That is not true. I will emphatically say that is not true. I, as a doctor, put on a mask when I go into a patient's room who has a highly transmissible infection. And masks work. It protects me. And why otherwise would surgeons not wear masks? I mean, surgeons have been wearing masks since the early 1900s. It's done for a reason, because it protects them and it protects the patient. And masks work. Masks work in communities. We have a lot of data now that communities who wear masks have a lot better mitigation for the spread of COVID than communities that don't. We know it in schools. And so if you say a mask doesn't work, you're just plain wrong. They do. It's an important tool. So the question is do we still need the mask? Do they work, but do we still need it? Is it a tool that we need to pull out or keep in the toolbox? So if you're used to fixing things around the house, you pull the tool out of the toolbox when you need it, and you use it when you need it, and when you don't need it anymore, you put it back in the toolbox, and maybe you get a different tool out. So times are different now, and such a large proportion of our population's been vaccinated. A whole heck of a lot of people got COVID during the Omicron, and that gives you some immunity. We have treatments now that are in good supply for people who are at higher risk. And we have a good supply of N95 masks that you can use to protect yourself. So we're moving. It's a stepping stone from moving from a pandemic to an endemic virus. We are going to put the mask back in the toolkit for the society at large, but if you're a person who still needs or wants that tool, use it. So who really needs to continue to use that tool? People who have underlying health conditions that put them at higher risk for COVID, people who are immunocompromised, and people who are at the extremes of age. They probably still need the tool. And let me give some examples. So if you have some heart disease, some lung disease, if you're a dialysis patient, if you are on cancer chemotherapy, if you've had a bone marrow transplant or an organ transplant, If you're pregnant, which puts you at higher risk for COVID, if you have a BMI over 30, so if you're overweight, these are people who have higher risks. And you might want to wear a mask when indoors, particularly if you can't social distance and it's crowded. So you can make those decisions on your own. And you can use either a surgical mask or an N95 to protect yourself. The N95 is the best for protecting yourself. And I can tell you, because I do this as a doctor, you can walk into a room with other people with COVID. If you're wearing your N95 and you got it on right, you're going to be fine, even with the underlying health problems. So there's some people who might want to continue to wear masks. There are also some people who are still a little anxious about it. I mean, we've been wearing masks for 2 years. It feels funny to take it off. You kind of feel a little bit out there, maybe like you're not quite, protected. And so if you want to wear your mask for a while until you feel more comfortable and safe about it, that's fine too. If it makes you feel better, use it. That makes sense to me. There's another group I forgot to mention 2 weeks ago, but that might want to think about it. If you got a big event coming up and you'd rather not have COVID for that event, just like you'd rather not have the flu or you'd rather not have some other viral crud, wear your mask a while before the event. Let's say your daughter or son's getting married and you're having a big get-together. He may want to lay low for a week or two and not get sick. I mean, it just makes sense. Wearing a mask will help you with that. If you're going on a big vacation and you've been planning on this vacation for 2.5, 3 years, and if you all of a sudden got sick and couldn't get on an airplane or you couldn't get through customs or immigration, I'd probably wear a mask for the week before that, because I don't wreck the chance to have my cool vacation. So you can use masks for that too. So the bottom line is that it's time for society to not really need to make all these decisions for us all the time. We can start to shift and make them on their own. And that's a very important stepping stone. It's an important stepping stone of going from an epidemic or pandemic to being endemic, because COVID's not going to go away. It'll be around. So next respiratory season in January, when it's normal cold and flu season, COVID will be part of that too. Maybe we'll put a mask on for a while again, but we don't need the government to tell us to do that, because we can protect ourselves by doing it. One of the other groups that might want to continue to wear masks for a little while, and I would recommend it at least for a couple more weeks, are daycare centers, for 2 reasons. One is kids in daycare can't get immunized yet. The other is that respiratory viruses are just more of a problem in daycare centers. They have been since the beginning of time. And so until our case numbers come down a little bit further, I would probably want to wear a mask or have my child wear a mask in a daycare center. And I'd certainly have the staff continue to wear masks. Daycare centers are going to be spending a lot more time outside. The weather's nice. Kids love to be outside. And it's a great place for them to be, which will make them safer anyway. But let's see how things go in the next 2 weeks. And then I'll tell you in 2 weeks whether daycare centers can start to relax that too. We still also need to wear masks on public transportation, although on school buses you don't need to. That was a special exemption. But other public transportation, even like a type of a community shuttle bus, so if your living community has a bus, small bus, or your university or your school, if it's not technically a school bus, you still need to wear a mask. Masking on public transportation, including airplanes, is going to get evaluated here again in another week or two, because the federal mandate for that's going to expire, so we'll see what they have to say. I can tell you the airline employees would like to have them stay, because airplanes are a place of a bit higher transmission risk, and the mask helps there.